Chapter 9: Treatment of ADHD and Disorders of Attention. This chapter explores the nature and causes of ADHD and other disorders of attention. Special consideration is given to diagnosis and matching the right behavioral and pharmacological treatment to the needs of the client and their families. ADHD is commonly presented in children. ADHD is diagnosed 2 or 3 times more often in boys than girls and is commonly comorbid with other mental concerns such as conduct disorder, antisocial personality disorder, substance abuse, anxiety disorder, and mood disorder, including pediatric mania. Similar symptoms in children are the same as in adults with ADHD. However, ADHD adults are less likely to have the hyperactivity externalized and are more internalized restlessness that might occur within them. As with many disorders, diet and the things that we take in may need to be taken into consideration. So individuals with attention disorders need to look at such intake such as stimulants may increase the risk of substance abuse as well as exacerbate the symptoms of ADHD and other attention disorders. Based on molecular genetics neuroimaging, ADHD is a heterogeneous neurobiological disorder, which pretty much so is saying that this disorder can take many shapes and many forms when we look at symptomology. But mainly the dopaminergic and noradrenergic pathways are affected. What has also been found and believed is that there is frontal lobe dysfunction and a dysregulation of neurotransmitter dopamine and norepinephrine in the frontal lobes, basal ganglia, the amygdala, and possibly the reticular formation, and screen out irrelevant information, have shown irregular activity in the frontal striatal networks and cingulate gyrus. Drugs used in the treatment of attention disorders stimulate these brain centers, allowing them to work faster and more efficiently. This stimulation assists the clients with both attention and retention of information. Clients less likely to abuse methylphenidate and other therapeutic stimulants stimulates the brain centers, allowing them to work faster and more efficiently. Stimulants also assist clients with both attention and retention information. Considering a childhood history of ADD or ADHD is necessary for an adult diagnosis. Taking into consideration family history of attention disorders is also important. History of substance abuse when we are talking about individuals with or who possibly have ADHD should be taken when we are doing a history as well as an assessment. Various assessment tools such as behavior rating scales, cognitive ability scales, as well as other assessment tools can be used for ruling out or ruling in ADHD. What is important is to rule out other disabilities such as learning disabilities or even physical conditions. Attention disorders need to be both treated with psychological and pharmacological treatment. Social skills training, time management techniques, vocational career appraisal, patient education, life coaching, as well as addressing poor self-esteem and other stereotypes are very important psychological treatments when we are dealing with clients, whether child or adult, with attention disorders. Daily coping strategies, conflict resolution, parenting skills, and assisting with formulating realistic expectations are important. Medications are typically given by titrating doses upward until competent symptomatic relief is obtained. Psychostimulants are used in the treatment of ADHD or other attention disorders. Stimulants and depressants have been effective due to the potentiating levels of dopamine and norepinephrine. Higher dosage typically corresponds to better response rates. Now, the side effects could be hypertension, insomnia, headache, weight loss, and growth retardation in children, amongst other side effects. If a person who has a problem sleeping, a sleep aid may also be given with their medications in order to help them sleep at night. Using a stimulant with a shorter lifespan may also reduce insomnia. Clients should refrain or be closely monitored if they are taking MAOIs, lithium neuroleptics, antidepressants. If the client is taking any of the aforementioned medications, they should refrain from using stimulants, or as mentioned, be closely monitored. Children who need to focus for long periods of time may be able to take a longer acting stimulant such as Adderall XR and Concerta. Concerta is released over a 12-hour period. Children probably should use a drug that has a shorter lifespan. Transdermal patches are also used for multiple dosages throughout the day and for children who have difficulty swallowing. Prodrug psychostimulants is generally well tolerated and effective for long-term use. The use of a prodrug may greatly reduce the potential for abuse. Clients should see a physician for a complete physical prior to taking any medications. Antidepressants are not as strong as stimulants. Alpha agonists may enhance prefrontal cortical regulation of attention and impulse control. Prefrontal cortical regulation, the locus coeruleus fires to relevant information, which improves overall attention. Alternative medications for clients who can't tolerate stimulus. They may be able to use an alpha-2 agonist. However, the side effects may be low blood pressure and cardiovascular monitoring is important. Antidepressants in children may increase the risk of suicidal thinking and behaviors. So a combination of psychotherapy, stimulants, and antidepressants offers a complete and directive approach. Parents are often concerned about putting their child on medication. Now, changing their diet and reducing sugary foods has not shown conclusive evidence of reducing ADHD symptoms. Children and adults with moderate to severe ADHD hasn't responded to dietary changes, behavioral interventions, and environmental changes alone. So educating the parent as well as clients about the benefits of medication is very important.